this person? Yes, she's Madame Curie, and she's very important because she gave us radium but did not patent the process so that there should be unhindered research and mankind should develop. She is the one person who has won 2 Nobel Prizes. Not one but 2 Nobel Prizes have been won by her. And there are 2 more Nobel Prizes in her family. Her husband has also won a Nobel Prize and her daughter has also won a Nobel Prize. So that shows us the importance and the level at which she was working. Unfortunately, she died of aplastic anemia, which was because of her exposure to radium. Because that time this concept of occupational safety and health was not there. She did not take enough precautions or she did not know about it. Radium was a new thing at that time and we lost her to aplastic, which was a preventable cause. Well, that brings me to some little things about OSH, occupational safety and health in healthcare. Because when every occupation has occupational health issues, we doctors should also have that. So who is a healthcare worker? So it's not only that doctor is a healthcare worker, but there are many more people who work in the curative setup, clinical setup, medical setup, like dentist, nurse, lab technician, radiology technician, physiotherapist, IAD, ward boy, pharmacist, laundry workers, maintenance staff. You have all of them there. But we hardly think of their health and their exposures. But there are various occupational risks in various areas, whether there are clinical, surgical, laboratory, physiotherapy, CSSD where all the sterilization takes place, maintenance, housekeeping, laundry, food handlers. Food handlers is an important area. And there are common concerns like shift work, emotional stress, ergonomics, slips, trips and falls, and violence. Of course, I do not think that would happen in this organization, but it happens in private sector. So there are bloodborne pathogens, there are airborne pathogens, there are sharps. In fact, there was a recent article which came out and which said that they analyzed the stethoscopes and they found that in 70% of the cases, the stethoscopes had Staph aureus, which is a resistant organism which was present on the stethoscope. And I don't think there is an elaborate process or procedure of sterilizing the stethoscopes in any clinical setting. So this is a simple example. Then of course there are bloodborne pathogens which we all know, like hepatitis B, and we also take care, preventive vaccinations we do. But there are also lasers, because nowadays there is more and more technology coming up. And then this latex gloves that we use, there are 10% of the people who are allergic to latex. Then in laboratories, in radiology, everywhere there are different areas, different risks which are already existing. Even in physiotherapy, pharmacy also, nowadays of course we all use pre-packed things, pre-packed medications, but earlier there used to be, you used to get loose medicines and the pharmacist would typically pack them and then issue them. I do not know how it happens here now. Now things must have improved. So there can be drug absorption, and then the CSSD, central sterilization and maintenance, there are also these compressed gases, anesthetic gases, various chemical agents, there are also burn centers and other things that takes place. Laundry is something which we never think of as our area and we are hardly bothered about it, but there can be various issues in that. There can be noise, heat, and then issues with lifting, contaminated laundry, shafts and fire hazards, they are there. I think in Kolkata there was a hospital which got fired recently last year, so that was a big issue, and you would know what is the cause of that fire. So then there are housekeeping. There are various chemical agents which are used. There are contaminated objects, lifting hazards, all those things are there. Food handlers, foodborne diseases, not only problem for them but problem also for those who are served by them. So this is a double-edged sword wherein you need to take care of them for their interest as well as for your own interest. Yes, and is another person, Louis Pasteur, whom we know very well. He was the first person who